But tonight I'm here to talk to you about Headache on the Hill, in case that's an event you may not be familiar with or that you're looking to get more involved with. And if you didn't join us at Headache on the Hill this year in 2019, we have an announcement about a way that you can get involved in the asks that we worked on in DC this year and that we're continuing to move forward with. So just to give you a little bit of background about what Headache on the Hill is, it's an annual advocacy event for migraine and headache disorders patients, providers, researchers, caregivers, anyone that has interest in migraine and headache disease. This annual event takes place in DC every February. And the event was started in 2007 by Dr. Bob Shapiro and Kathy Gardner. It was started as a project for them, and the first year that they put it together, they had 45 people come to DC and attend the event, and it was mostly all providers, headache specialists. The event has grown. This year we had our 12th annual Headache on the Hill event, and it was our largest event ever. We had 160 advocates from 42 states. So in addition to the growth that we've seen with the number of participants, one of the things that I think is most exciting is that we've seen an increasing volume of patient advocates who have been coming to the event. So as I mentioned, it used to be mainly providers, and now we're seeing a lot more patients getting involved, and we're really happy to see that. This year it was over 70% of the participants were patients and 30% were providers. So each year when we go to DC, there is a specific ask that we're going to work on. And I should actually back up and explain the way that Headache on the Hill works is people apply to attend the event, and I'll talk more about that towards the end of the talk tonight. And if you're accepted, you come to DC for 2 days in February. The first day we do our advocacy training, and that's a day where we get together, you meet with the people that you're going to be going to Capitol Hill with the next day. We talk to you about what to expect on Capitol Hill, how to have a meeting with your members of Congress. We actually schedule all of the meetings for you, so you don't have to worry about that. And then we train you on whatever the specific ask is that we have for that year. So you might wonder, what is an ask? An ask is a specific request that we make of our members of Congress. And it has to be something that is actionable. So going to our members of Congress and saying, I have migraine and I need you to fix this, or we need a cure. Those are not things that our members of Congress can resolve for us. But if we go to them and say, we have some specific language that we want to see included in a bill, and we would like your support for that. And more specifically, the way we are asking for your support would be to have you sign on to a letter or request this specific language, and here's how you would request it. So we give very specific asks to our members of Congress. And each year they vary a little bit. They're usually, I'd say every year there's been an ask that is related to the NIH, the National Institutes of Health, and the amount of funding that is currently allocated for migraine and headache research. But there have been asks of other agencies, other federal agencies. We've worked on asks with the Department of Defense. Through our efforts over the last 8 years or so, we have seen over $18 million in funding for chronic migraine and post-traumatic headache disorders through the work that we've done with the Department of Defense. We've worked with the FDA. One of the things that came up recently was that there were any over-the-counter medications that you may take for migraine, like Excedrin migraine, for example, didn't have any warning sign language on the bottle about the potential for you to get medication overuse headache from using those products. And so there is now a warning label on over-the-counter migraine medications letting you know about that potential harm. We've worked with the Veterans Administration and just in the past couple of years had over $10 million allocated to establish 5 Veterans Administration headache centers of excellence around the country. So providing better care for our veterans, and that will trickle down to the civilian population as well. If there's research taking place at the VA, that research benefits the civilian population eventually. We've also worked closely with CMS, and we're currently working on an issue with them around the coverage of oxygen, home oxygen for cluster headache patients. And we're making good progress there. But the thing with our asks at Headache on the Hill it's not something that happens immediately. So you don't go meet with your members of Congress and then get a law passed that same week. It can take literally years to have some of these things come to fruition. So this year, in 2019, when we went to Headache on the Hill, we had 2 asks. One was, and they're both for report language. One was related to the NIH. So there was $500 million a year in funding allocated for the HEAL initiative, helping to end addiction long term. That's what HEAL stands for. And $500 million a year for fiscal year 19 and fiscal year 20. And within that initiative, there is language that covers research for migraine and headache disease. Once that initiative was funded, NIH put out something called RFAs, Requests for Application. And this is how researchers, investigators, find out what their opportunities are for things to research. And our ask is, because there is so little funding and focus on migraine research, and now we've got this huge pool of money, we're looking to have the NIH specifically announce or have an RFA saying that there is funding for migraine and headache research. So in order to make this happen, the money is already there. We're not asking for additional funding in this case. We're asking for report language or direction to be provided to the NIH to help direct how those funds get used. The second thing that we worked on this year is an ask for the Social Security Administration. So many of you who have migraine understand or know or have heard that the process of applying for disability insurance through the Social Security Administration for migraine or headache disease is extremely difficult. And part of the reason that that's so difficult is that the Social Security Administration uses something called the Blue Book. It was originally a blue book that listed all of the different disabilities that they would cover for disability insurance. And migraine and headache disease are not currently listed in that blue book. They never have been. So that makes it really hard if you're applying for disability and you have migraine or headache disease. What happens today is if you're a patient with migraine or headache disease, Social Security compares your claim to the requirements for a person with epilepsy who is applying for disability. Now, they may both be neurological diseases, but that's about where the similarities end. And in addition to that, we're actually not even sure which pieces of epilepsy indications are being, what are the specific requirements that the Social Security Administration is looking for in people with migraine and headache disease. So as a result of that being one, not listed as a disability, and two, the fact that we're compared to another disease state that is not applicable makes it extremely difficult for people to get approved for Social Security disability insurance. And we feel like this is egregious because it's our right. We pay for Social Security disability. It's insurance, and we shouldn't be discriminated against because of the specific disease that we have. So our ask of the Social Security Administration had multiple pieces to it. One was that they need to add a listing into the Blue Book for migraine or headache disease. Two, until they do that, they need to provide further clarification on what the specific criteria are that they are comparing migraine and headache disease to as compared to epilepsy. And the third piece of that ask is that we ask that they review their category listings at least every 5 years, because it's been, in some cases, up to 20 years between evaluation of their disability listings. And just to share an interesting statistic, people who initially apply for Social Security disability who have migraine and headache disease, 17% of those initial claims are approved by the Social Security Administration. People with MS who apply for disability insurance, 52% of them are approved the first time around. And people with Parkinson's, 78%. So there's a huge disparity there, and we're looking to correct that. So these two asks that we had, one was of the NIH and one was for the Social Security Administration. In both cases, we were asking for what's called, like I said, report language. And when we present our asks to our members of Congress, we have an ask for the House side and an ask for the Senate side. And in this case, on the House side, we had Congressman Peter Welch from Vermont and David McKinley from West Virginia issued a letter called a Dear Colleague letter. And that's basically a letter to all of their colleagues on the House side. And in that letter, they're supporting our request for this report language. And they're asking for other House members, representatives, to sign on to this letter that will be sent to the LHHS, Labor, Health, and Human Services Appropriations Committee to hopefully get that language included in this year. So right now, we are when we went to meet with, we had 223 meetings in DC in February. So we met with 223 offices, and this was our request of them. But we still need more voices out there. We need more people to reach out to their members of Congress and let them know that this is what we need. So on the House side, we're asking our representatives to sign on to the Dear Colleague letter. For our senators, we're asking for the same two things with NIH and Social Security, but they need to request the report language themselves. There's not a letter for them to sign on to. They need to just submit the request, and we present to them the actual text of the report language that we're asking them to request. So typically what happens after Headache on the Hill is the advocates who are there send a follow-up email to the offices they visited with and come home and may correspond with them a couple of times throughout the year to follow up on the ask that we had. And eventually, in time, some of these offices will agree to the requests that we submitted to them. What's really exciting this year, and one of the reasons we're doing the Facebook Live tonight, is that we have an opportunity for you to take part in this as well. So we've never been able to engage our advocacy community outside of those people who come to DC, but for the first time this year, we are doing that. And we actually have a really short window to make that happen. So we need you to reach out to your members of Congress between now and March 28th and make this exact same request that we made in person in DC. And we've made it really easy for you to do this. There is a link that you can go to for our Action Center, and the American Migraine Foundation will share that link on the Facebook Live tonight. And you just click that link. It provides a written description of kind of what I've walked you through tonight with our 2 asks and the actual report language. You put in your name, your home address, and or your work address. That helps the system know what district you belong to and who your senators are. Then you have the opportunity to add in 1 or 2 sentences explaining what your own situation is and why these asks are important to you. You click send, and that email goes to your members of Congress. And this can make a huge difference for us. If we had 223 meetings. There are 47 million Americans living with migraine disease. If we could get 10,000 of them to submit these letters, it would be hard for members of Congress to ignore these requests based on the volume that they start seeing. So I'm hopeful that you will consider taking this on and submitting your requests, and ask one friend or family member to do the same. And hopefully we can drive change. And if you follow AHDA on Twitter or on Facebook or sign up for our newsletter, we will definitely keep you posted on the progress of these specific asks and other asks that we're working on as well.